We're going to show you the prone extension exercise, and this one is really important if we have any active disc bulges in our spine. So the discs are the spacers in between each of our vertebrae. They're the cartilage that give our spine all of its movement. And what the disc can do is say that we get the vertebrae that gets jammed and out of place. It can put more stress on the disc. And then we continue to bend, twist, and lift. That can cause these little tears at the back part of the disc that then can get into the nerve here then as well. So the prone extension exercise is going to be one that helps to get that disc bulge into a better position. So there's 3 different exercises. The first exercise is basically just laying face down on the floor or in bed. And what that does is it uses gravity to help get that disc into a better position. You're going to do that for 2 to 3 minutes, just letting those muscles along the spine start to relax. This one is also a first aid exercise for any acute low back pain, so you can remember this one. In the second exercise, what will happen is you're basically going to go up onto your elbows. As you do this, we start to put that curve in the low back. What it does is it starts to close down the back and open up the front of the disc and allows that disc, the corners of the vertebrae should get on each side of the disc and force it into a better position, which gets that pressure from the disc off of the nerve here. If there's any pain while you're doing this, the pain should never be at higher than a 2 or a 3 pain level. Make sure that you're just going through those ranges of motion that don't cause a lot of extra pain. And then in the third exercise, sometimes when this disc has gotten really bad, you might not be able to do the third exercise right away, but it's going to be a cobra stretch where you're really starting to put more extension into the low back then as well. If you feel a lot of sharp catching, pressure, pain, stay away from the third exercise until you're ready then as well. So you can stay in communication with your doctor about that last exercise. So the first exercise, you're just either going to be laying in bed or on the floor. You're going to focus on letting those muscles along the spine start to relax. In the second exercise, you're going to do that for 2 to 3 minutes. The second exercise, your elbows are going to get underneath the shoulders. You're going to be looking straight ahead with your head like you're a kid watching Saturday morning cartoons. And think about that curve getting into the low back here. There might be some pressure, but it shouldn't be very painful as you're doing this one. Hold this for 2 to 3 minutes. In the last one, you start to press up, holding for 1 to 2 seconds at a time, as long as you feel comfortable doing it. Go back down, rest, hold for 1 to 2 seconds if you're able, and do it reps of 10.